Hi, my name is Jennifer. I'm going to be doing the dressing change using sterile technique video today. I have my school ID. I have plain gray scrubs. I still don't have my Nightingale scrubs. They should be here very soon. Nothing on my wrists or my hands, nothing on my nails. I'm going to go ahead and adjust the camera so that you guys can see my sterile field. I have my biohazard bag right here, sanitizer for hand hygiene, regular gloves. My wound already has a band-aid on it, and my dressing change kit. So we're gonna go ahead and get started. The first step is gonna be to introduce myself and verify the patient's information as well as explain the procedure over to them. So knock knock, opens the door. Hi, my name is Jennifer. I'm gonna be your nurse today. Can I get you to verify your first and last name as well as your date of birth for me, please? They would give me that information. I would look at their wristband, verify that the information matches, move on to the next step. So today we're gonna be removing your old dressing and putting a clean new one on there. Do you have any questions? Are you comfortable? Patient has no questions. Patient is comfortable. We can go ahead and start. Okay, first thing, hand hygiene. And we're gonna go ahead and glove up to remove the old dressing. Now when we remove the old dressing, we wanna make sure we're not pulling it. So we're gonna go ahead and just kind of like pinch around it and just kind of lift it up. Okay, dressings removed, go ahead and throw that in the biohazard. We'll remove our gloves. Okay, next thing we're gonna do is hand hygiene one more time and apply our sterile gloves. Okay, we're gonna go ahead and open our dressing change kit, fold this flap over like this so that I have access to everything inside. We're gonna grab our gloves. And I'm right-handed. For whatever reason, it's easier for me to start with the left, so we're gonna go ahead and do that. We're gonna grab the inside of the cuff here and just kind of shimmy our hand in. Okay, one glove is on. Now we're gonna go ahead and put the next glove on. We're gonna use these 3 fingers to go inside the cuff, making sure we don't use our thumb to break sterility. Okay. Okay, now we have both sterile gloves on. We're gonna make sure that our arms are above the hips the whole time. Now we need to remove this paper. We're gonna pinch the inside where it's sterile to sterile, throw it in the biohazard bag. Next thing we're gonna do is clean the wound. We're gonna start from the inside, go towards the outside. My left hand is gonna be my sterile hand, and my right hand is the one I'm gonna be working with. So I'm gonna go ahead and reach in and grab the sponge with my left hand, drop it into my right hand, and start cleaning. Again, from the inside to the outside of the wound. So we're not reintroducing any new bacteria. Okay, dispose of that in the biohazard. Next, we're gonna grab gauze to go ahead and dry the wound. Again, left hand is going in, dropping into the right hand. From the inside to the outside. I only have one gauze in my kit, so I'm gonna just use this same one, but normally you would toss this one and use the second one. Okay, that's done. Next step is gonna be to palpate the wound to see if there's any abnormal odors or discharge. So we're gonna use 2 fingers, right hand, since this hand is the dirty hand. And we're palpating. Everything looks good. This is a step where you would measure if you need to. We don't need to measure for this video, but if you did need to, this is where you would do it. Next step is gonna be applying the Tegaderm onto the wound. At this point, we're gonna break sterility because we're gonna need 2 hands to open the Tegaderm. So I'm gonna reach in with the left hand, grab the Tegaderm, and go ahead and remove this part right here. And apply the Tegaderm. Okay. Now Tegaderm has been applied. We can dispose of all of these materials. Again, no more sterile field, or both of our hands are dirty. Toss that, toss this, toss this. Final step is to remove our sterile gloves. So we're gonna go ahead and pinch right here. Ball up in this hand, 2 fingers, skin to skin. Dispose of those right there. Hand hygiene. Right, at this point we are done with the procedure itself. We're going to ask the patient if they're comfortable. Mr. So-and-so, are you comfortable? Yes, good. Go ahead and exit the room, close the door for privacy, and we're going to go ahead and go back and document what we did. And that's it.